Hey, Croc Nation. Don't forget to like, subscribe, and share the podcast to your friends. Visit our website, crocvip.com. We would love to hear your feedback.
This is Citizens Reunited to Overcome Cancer. We know it as the Croc Podcast, and it starts right now.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Here is your host, Dr. E.
Hello, everybody. This is Dr. Tommy and Ellie from Citizens Reunited to Overcome Cancer. I am very grateful and humble that you all decided to listen to today's podcast, and I can't tell you how happy that makes me. Here at Croc, what we try to do is we try to do two things. We try to make your survivorship an easier journey by giving you information and advocating for you, but we also are here to help all of our practitioners that are taking care of our courageous survivor thrivers as well, up their game and their level of performance. Joining me today, as always, is my co-host, Angel Santana, who has his own podcast called Have Faith, Let It Begin. This podcast is based in faith and is a perfect bookend to the Croc podcast. I really recommend that you listen to both together. Angel, welcome. I'm so excited about today's podcast.
I am too, and mainly because of your background. It reminds me, and I'm talking about your actual virtual background here. It's the real background of your office, but it brings me back to the first season when we were recording together in that room. But nothing greater and nothing more exciting than coming together. It's kind of like your title, we reunite, and we talk about our cancer patients, our thrivers, our survivors, but more importantly, we have a program here that is designed for every single person.
Angel, tell everybody how they can get onto our website.
I'm so glad you brought that up. The Croc Podcast is available to each and every single person. We have social media now really linked up where it's very easy to get a hold of us. So if you haven't had a chance, what I suggest you do is you go to Croc VIP. You can do it that way. And that's one of our best and only ways you can get around to us. You can email us exactly. Also, it's podcast@crocvip.com. We're also available on Twitter. We have a TikTok account, YouTube account. And if you have any questions, all you have to do is talk to us on social media. You're not going to get a third person. You're going to get either Dr. E or me.
Awesome, Angel. So without further ado, let's move forward. And we're going to be talking today about a paradox, probably a very scary subject. And I'm hoping that by the time this podcast is ended, you will not be as frightened. I get many questions asked of me. And of course, you would imagine many of the questions are repetitive. And if I were to pick a top 10 question, this would certainly be in the top 10. And that would be, hey, doc, you're doing all this stuff, to cure my cancer, but is it going to cause a second cancer with all these toxic chemicals you're giving me and these toxic x-rays? What's the story? What's the deal with these secondary cancers? And today's podcast is inspired by two young ladies that I saw a few weeks ago that actually had a non-malignant entity called the keloid. So a keloid is a hypertrophic scar. Certain cultures, certain what would you say? Certain groups, ethnic groups have more chance or opportunity to cause these hypertrophic scars, especially after a piercing or after surgery or after trauma. And these are generally people that are very young, in their 20s, that come and get the scar taken off, and they get radiation therapy afterwards. And they ask me, what are the side effects? And I say, well, to be honest with you, maybe a little skin reaction, and that's about it. And then my conscience kicks in and says, you forgot to tell them about the chances of getting a second cancer, because these young people are going to be alive for 50, 60, 70 years. And of course, radiation and chemotherapy do cause second cancers. So it creates this paradox. And when I think of these young 20 and 30-year-old kids, of course, we think of our own children and how we would manage treating them for these types of entities and what the risks are and whether or not the risks are worth taking. And, thinking about this for a couple of weeks, Angel and I have had some technical issues over the last week or so, so this is being aired a little later than we would have liked. But having the time to think and ruminate and just to kind of just spend time just having this permeate my brain, I noticed something that was really very disheartening for our survivor thrivers. So if cancer wasn't hard enough, right? There's the fear factor, the lethality, of getting cancer, the fear of death, the reality of death, the general way that cancer behaves, which is your body basically, gives up the ship and is almost terrorized and taken over, run over by this cancer, and the cancer could spread from place to place with metastasis. And then you give these patients your best shot with the surgery and the radiation and the chemotherapy, and that causes this new normal to be completely abnormal. And then you come to find out that the treatments that you just had to cure your cancer, your chemo and your radiation specifically, could also put you at higher risk for a second cancer. So when that question comes up in the clinic, Angel, I say to myself, I would, because all the patients want is a number. They're asking a simple question. Hey, doc, are your treatments going to cause a second cancer? And I wish I could just say it increases your risks to 1 in 10, 1 in 100, 1 in 10,000, 1 in 100,000, 1 in a million. And I think to myself, boy, I wish I can say that, but sadly I can't because it's much more complicated than just a number. And I also want to let you know that it is not a little thing. Secondary cancers constitute 15 to 20% of all cancer diagnoses in the cancer registry. So, in simpler terms, 1 out of 6 cancer survivor thrivers, and I'm not talking about recurrences or metastasis, I'm talking about a secondary cancer, will be affected. Now, let's go to the actual definition between a secondary cancer and a second cancer. Now, they seem like they're the same thing, but they're absolutely not. So, a second cancer is just a person who has cancer, gets cured of their cancer, gets a separate cancer in a different spot that has nothing to do with their treatment. So this is just the risk of getting a second cancer. But then this is one of my favorite words in the dictionary. It's called iatrogenic. That means that there's also secondary cancers that are directly related to the treatments you receive. So they're iatrogenic cancers and they're directly due to radiation therapy and chemotherapy. So sadly, everybody, the answer is anything but easy. But take heart, by the end of this podcast, hopefully in less than 20 minutes, you will know all the nuances and risks that may not exactly answer your question, but certainly will make you more knowledgeable and knowledgeable enough to advocate for yourself and knowledgeable enough to be able to sleep soundly at night. So, of course, when we talk about secondary cancers or second cancers, we always start with our pediatric survivor thrivers. We do this because we have most of our data regarding second cancers / secondary cancers are done on kids. The other thing is kids are being cured at a very high rate right now, greater than 80% 5-year cure rates for our kids with cancer. So as a result, these kids are living longer and living longer to see these second / secondary cancers. Number two is that these kids are getting treated with the same stuff that we give adults, except at lower doses, but their body size is much smaller. Their genetic predispositions, why did they get the childhood cancer anyway, in the first place, plays a part. And their tissues are more vulnerable and more susceptible to the radiation therapy and chemotherapy. So, as I said, most of the studies are of the pediatric cohort. There's a higher survival rate, which means patients are living longer to get these second cancers. 40 to 70% of our kids will also present with health problems down the road from their treatments. And as I said, the risk of secondary cancers in this subset are 3 to 10-fold of the general population. So let's take a look at what we're talking about. What is the nomenclature? What are the words? What is the vocabulary when we're talking about secondary cancer? So we look at not what are your, we're not like DraftKings. This is not like a probability, or, we're not gambling. These are not gambling, data. We're looking at a standardized incident ratio, which means the observed numbers of second cancers and the expected number of cancers that are basically put this ratio together for us. And the other thing that's interesting is this number will go down as the patient, the survivor thriver, gets older, and the age of their diagnosis. It will go up the longer the follow-up time, so you have a higher risk if you're followed longer. And it usually peaks at about 5 to 9 years after the first diagnosis and then drops afterwards. So remember what I said, second cancers are different than secondary cancers. So let's talk about, Angel, a misconception. So one of the things that I think really freaks out our survivor thrivers is the misconception that if you have a cancer, then that sort of inoculates you or protects you from a second cancer, and that's anything but the truth. So I'd like to say that, in the world, hey, I've gotten enough of this, enough bad luck. My bad luck is done. I've had my share and that's it. I'm good. But it's not like that. So I just want to let everybody know that just because you've had cancer and you've beat it doesn't mean that you can become complacent. You have to remain vigilant. And the other problem is that the same causes that produced the first cancer are still in effect. So let's talk about first lifestyle. If you're a smoker, if you're a drinker, you're going to have a higher risk of head and neck cancer, lung cancer, bladder cancer, esophageal cancer. That's not going to go away. It's going to get worse. I can't tell you how many times I cure a patient with head and neck cancer only to see a year, 2 years, 3 years, 4 years, whatever later that they get a lung cancer because they didn't stop smoking. Also, we're all continuously exposed to the same environmental hazards. So whatever caused that first breast cancer, as long as you don't sell your house and go live in, Shangri-La somewhere in, Indonesia, your chances of getting a secondary cancer could be related to your environment. Also, genetic predispositions. So that you've heard of the BRCA genes in our breast cancer patients, Lynch syndrome, and so many other syndromes that I couldn't even pronounce, also put you higher risk for a second cancer. And some of our cancer survivor thrivers are also immunosuppressed, either immunosuppressed from all the treatments they've gotten, immunosuppressed, low blood counts because of the chemo radiation that makes them at higher risk as well. So what are the risks now? We're going to talk specifically now, not about second cancers, which are not related to your treatments, but secondary cancers, which are iatrogenic, again, that fancy word, are caused from our chemo and radiation. So chemotherapy agents are kind of linked together or put together in different subsets. So you have the alkylating agents. These are the agents that bind up the DNA and kill the cancer cells. You have the topoisomerases, which kind of mess up with the mitoses and all of those spindles and things that help our cells divide. And of course, that makes you at higher risk for mostly blood cancers, leukemias, and lymphomas and things like that. Now, with radiation therapy, we knew from 1890s that this was, pretty toxic stuff. Because shortly after using radiation therapy, after the discovery of X-rays, people were starting to get skin cancers and other things. Our own, I would say the mother of radiation, Madame Curie, one of the early pioneers, ended up dying of leukemia. So, most of the fact that we saw this cause and effect between radiation and secondary cancers came out very, very early. We saw this. So a lot of times patients will ask if there's secondary cancer with radiation or if they're related. So if a person had a breast cancer and then gets cancer of the big toe, they're not related because of and gets cancer of the big toe within a year of the breast cancer. then radiation therapy is not the culprit, because you need time, usually, many, many years after radiation, and you need the secondary tumor, which is usually, a sarcoma, to be in the area of the radiation portal. There was a large study. Oh, just quickly, I met a patient, this week for cancer, for a consultation, and her mom was treated by me in the 1990s, and she got a sarcoma in the radiation field. So just to kind of show you that it does happen. But the study by Bennington and Gonzalez, these are 650,000 patients with a 12-year follow-up. So this is a real study, real data with lots of numbers and lots of follow-up. They came to the conclusion that because of chemotherapy radiation, that increases your chances of a second cancer in excess of 5 per 1,000. So that's about as close to as an answer as I can give to the patients based on a really good study. Just to give you guys just a quick, inventory. So the alkylating agents, I'm going to throw a few at you. Cyclophosphamide, ifosfamide, cisplatinum, carboplatinum, chlorambucil, mustard gas, or procarbazine. These are the ones that we're talking about when we talk about alkylating agents. And the topoisomerases and the anthracyclines are etoposide and adriamycin. So these are some of the agents that, in case you've had these, to know in the back of your head, to keep an eye out for things. As far as the radiation risk factors, age and dose are very important. The size of the field, which now we're less is more, Angel, like we've been talking about, especially in the old Hodgkin's disease patients. The organs that we're treating, so some organs are more sensitive to radiation than others. And again, the use of environmental factors like smoking will increase the risk of radiation causing a second cancer. Also, when you put chemotherapy and radiation together, the risks are additive. So it's not like 1 + 1 = 2. It might be like 5 × 5 = 25. So another thing for our survivor thrivers to consider. So what can we do, Angel, to reduce risk? Number one, be knowledgeable. So I'm hoping that this podcast will be your first introduction, to the knowledge of these second cancers / secondary cancers. Number two, know what advances in technology are available that can reduce your risks. So with radiation therapy, we have stereotactic body radiosurgery, which are large doses to very small areas. We have intensity modulated radiation therapy, again, to reduce the amount of normal tissue that's being exposed to radiation. Chemotherapy, there's new targeted therapies, immunotherapies that may make alkylating agents, topoisomerases, anthracyclines, perhaps make them irrelevant in the future, make them extinct. And number four is have in-depth discussions with your care providers and when you're making your shared decision making. So when you're deciding what to do, make sure that you talk about this and you get input, from your clinician. And if your clinician doesn't know what you're talking about or feels that you're taking up valuable time, that they don't have, then that's, a red flag to change practitioners, because you really need to be clear that you're going to be looking out for this for the next 5, 10, 15, 20, 25, 30 years. Number five, remain vigilant. So your screenings, you keep up your screenings for breast cancer, et cetera, colon cancer. In addition, if you've had breast radiation or Hodgkin's disease, radiation to the chest, again, more reasons to be vigilant. You might also want to talk about lifestyle changes, right? You want to maybe try to reduce your smoking, ideally eliminate your smoking, reduce your alcohol intake, extinguish your alcohol intake, start, exercising, keep a good body weight, and again, watch for symptoms, change in bowel habits, non-healing sores or ulcers, lumps or bumps around your body, cough, fatigue, headaches, pain. These are all things to think about and keep an eye out for. So special note quickly on Hodgkin's disease, which was really the perfect storm because back in the 1940s and 50s, when we were just coming up with all these new alkylating agents and radiation therapy for Hodgkin's disease was done utilizing what's called a mantle. So if you remember the old Roman and Greek soldiers, they would have the helmet and then they would have this big piece of metal that would start from their neck and come down around their arms and cover their heart and their chest, almost like a bulletproof vest. That's the radiation portal. It was called a mantle because it was recognizable as almost like the mantle that they used for war back in the right at AD right in Jesus's time, right? So Hodgkin's disease, perfect storm, all of these very toxic chemicals, all of this very toxic radiation, and the recurrence rates of came down, and the survival rates went up, but the risks, the relative risks for a secondary cancer would be 2 to 4 fold the normal population. It could even go up as high as 50%. I'm sorry, 50-fold, especially if tissues like the thyroid, the breast, the skin were in the portal. Also, higher risks of leukemia and lymphoma. The type of chemotherapy that was given for Hodgkin's disease in the day was called MOP. So it was mustard, vincristine, procarbazine, and prednisone. So 3 out of the 4 of these drugs, were, cancer-producing agents. Now we're using what's called ABVD, which is still toxic, but much less toxic as it relates to secondary malignancies. So in conclusion, Angel, couple of things, couple of advice, war cries for our survivor thrivers. Number 1, do not panic. Number 2, do not get too freaked out by this. Make sure you know the relative risks are not that high. They are existent. Be informed. So this podcast could be a very good first step to know a little bit about what your risks are and how to minimize them. Be proactive. No one's going to be more of an advocate for you than you are for yourself. Get involved. Be involved with your treatment. Be alert, especially to symptoms as far as and to your risk factors. And you know what? At the last thing to tell you, be alive. Stay in the moment and enjoy your survivorship. Angel, your thoughts?
Quick question. I know that this is it's on topic, but a little off topic. We didn't really spend time, and maybe we could do this in the future. Hereditary. Can you touch base just a little bit? I know that this would extend the program a little longer, but cancer is known to be hereditary at times too.
Yep, I mentioned that when we were talking about risk factors. People have genetic predispositions. They have BRCA genes. They might have, syndromes. Gardner syndrome is, multiple polyps. Some people have, this preponderance of so many polyps that's hereditary that sometimes your entire bowel is full of these polyps that are precancerous. So you definitely should know your risks. Any woman that gets diagnosed with breast cancer, especially if it's a family history of breast cancer, should get tested, get their genetics tested. And I think that in the future, Angel, even primary care physicians will basically be checking everybody's genome and their DNA and, their genes to see who's at higher risk, not just for cancer, but maybe for diabetes or high blood pressure or stroke or whatever, heart disease. So I think in the future, genetics is going to play a big role in pretty much all disease states.
I think also what happens in this episode is it allows all of us to remember that you have to stay alert. You have to be aware of your surroundings, and only person that knows more about our body is ourselves. And that's the key.
Yeah. And the take home message to me is because of all the people, as I said in the beginning, that we try to help with this podcast. So number 1, we try to help our survivor thrivers, right? To give them information for a better survivorship, but also learning lessons on how to be a better practitioner, how to be a better provider, to our cancer survivor thrivers. And for me, this is as much a learning experience for me as it is for anyone else who listens, even though I'm the one talking. And for me, I think one of the humbling aspects is to know that the materials that we use in our job. So if you're a medical oncologist, you're using all of these toxic chemicals. If you're a radiation oncologist, you're using these big machines to distribute radiation, to kill cancer. And, we become sometimes, I guess, have tunnel vision, and we say, hey, we have this great new machine. It's the state of the art, and we're going to be so focused with our radiation beam, and how could it ever possibly cause any harm to anyone? We're doing nothing but good. We're curing people of their cancer, when, we see the fact that not only do we hurt people with our modalities, even if we do everything right, sometimes we can really hurt them with these secondary cancers. So it is very humbling. And the other thing is, it also should make you more patient when you do speak to a survivor thriver, because we're usually so busy, and if someone crams our time with a question, especially a question about, hey doc, what's the chances of getting a second cancer? And I actually get this a lot with my iodine patients, so patients with thyroid cancer that I give radioactive iodine to. I've never seen a second cancer from radioactive iodine in 35 years, but that should still not make me be brief when someone asks me a question about what the risks are if they do take that radioactive iodine pill. I should be really knowledgeable about the fact that this is very serious stuff, and and it's a very, very high responsibility job, to be a provider, when you have the keys to the Lamborghini, of these toxic automobiles. You really have to be very humble, and you have to be very wary. So I'm going to finish up today's podcast with our beautiful croc invocation, or I call it a blessing. I just want to let everybody know out there that we don't know exactly what you're going through. We haven't taken that walk in your shoes, but we have been around the block to take care of so many of you survivor thrivers that we get the gist of it. We understand what you're going through to some degree. And one of the things is not only the fear of having cancer, not just the fear of being cured of your cancer, not just the toxicity of what your life is like after cancer treatments and your altered and changed life and your new abnormal normal. Besides all that, the risk of always having to think about not only the cancer coming back or the cancer going to a new site, but also a second cancer that may pop its head up to mess up your life even further. So in that regard, do the things we just mentioned, and you have a higher chance of getting through to the other side. And wishing you, as always, nothing but the best and the greatest journey and the greatest survivorship, and wishing you a long, healthy, happy, and cancer-free life. God bless you. God be with you. Peace.
Hey, Croc Nation. Thank you so much for listening to our show. We're going to be back in 2 weeks with another new episode. In the meantime, don't forget, we will continue to run reruns, giving you an opportunity to look back when we first started in our first season. Also remind you that we are available on every single podcast platform. And what really helps if you liked and share our podcast with your friends, because we would love to hear that feedback. Thank you.